Good evening, everyone. So this week we're to discuss another of the 9 core values that define our program. In this session, we're going to be discussing the value of ethics and what it means to be an ethical nurse. I'm going to try and keep this one short as I'm coming off of a pretty long shift and I kind of like to sleep. So ethics can be broadly defined as the guiding beliefs and ideals that characterize and govern an individual's behavior in a given circumstance. In layman's terms, this means that ethics are the beliefs that help one decide right from wrong. Though sometimes relative to any community, ethics are not universal or inherent themselves. While one individual holds an ethical certainty, that same ethical certainty may be considered simply deplorable by another. This struggle between defining how to decide what is considered acceptable behavior in a world where acceptability, where right and wrong themselves are open for interpretation, is the basis of a branch of philosophy known as ethical or moral philosophy. This branch of philosophy seeks to systematically explain, categorize, and defend various schools of thought regarding morality and ethics. But how are we going to relate those broad ideas to the everyday practice of nursing? So in order to effectively carry out the role, each nurse must act in accordance with not only their personal ethics, but also with those that define the nursing profession as a whole. While sources may vary in identifying specific core values, the roughly 7 specific ideals that create the foundation of the ethical decision-making model of the nurse are beneficence, non-maleficence, justice, accountability, autonomy, fidelity, and veracity. Using these principles, a nurse may guide themselves to an action or decision that is seen as acceptable or correct in the eyes of the nursing community. It's not unheard of for this code of ethics to sometimes be at odds with the personal ethics of a nurse. Recognizing that difference and consistently acting in a way that could be considered moral and ethical with regard to the patient and the profession first is what separates the professional ethical role of the nurse from the personal moral compass that one may possess and use on a daily basis. Much like the various philosophical models that profess to be the correct way to determine right from wrong, nursing relies on the adherence to these principles in order to define the correct choice for the nurse to make in a given situation. If a decision is considered at odds with one or more of these guiding ideals, then the argument may be made that a nurse might not be acting in an ethical manner. While this seems relatively black and white in theory, practice brings to light the gray area that many decisions are made in. Does beneficence toward the community, for instance, take precedence over the beneficence of the individual? Does the contentious determination of capacity made by a provider overrule the nurse's obligation to facilitate autonomy? And is the desire to even question the obligation itself a proclamation of the ineptitude of the very idea of autonomy? Questions like these have guided many a quill and pen to write many an essay about morality and the question of human value. In conclusion, while the nurse may recognize and accept a set of ideals valued by any number of various groups, organizations, or schools, it is for the individual to decide exactly how those ideals may guide their own practice. To that end, it is also an innate demand of the profession itself that the nurse accept that they may be judged and challenged for their interpretation of these ideals, and that those challenges may directly impact not only how the nurse practices, but also the endorsement of the nurse to practice at all. The nurse can only strive to navigate these complex topics with the care and compassion of those philosophers that came before them. To continue to learn and hone these values each day and to never falter in their application is perhaps one of the hardest challenges that a nurse will face. So I guess that's going to be it. I hope that I've effectively explained the topic of ethics somewhat. And I really look forward to watching everybody else's videos this week. Have a good one, folks.